The project started in January 2018 with the first intervention, if you like, came live in April 2018, and I myself have actually been part of it since December 2018. Whilst at the Oxford University hospitals, it's within the maternity setting. Because it's the outpatient setting, it could be transferred quite easily. So, for example, patients that need to get ready for surgery need to increase their physical activity levels before surgery, and also COPD and things like that. We have implemented within the maternity setting 4 main things. We looked at the maternity pathway, we looked at the patient journey and where we could impact that the most. The booking appointment is done on our computer system, it's all electronic, and within that we have implemented a physical activity calculator, so it gives us a baseline of women's activity levels right at the beginning of pregnancy, and this has captured over 100,000 women so far, so it's been really, really successful, and it's actually won some awards and recognised by RCOG. The second thing we did was to implement a training session. So all healthcare professionals that interacted with women in pregnancy would be trained to deliver brief physical activity advice. So we went around the community midwives and held training sessions within the hospital. The third thing we did was to change the environment. And then finally, the last thing that we did was I actually attend the gestational diabetes outpatient clinic, where I talk to women as a group and talk about physical activity levels and the current recommendations. And then I invite them individually to attend a 20-minute motivational interview. Patients are more involved in their care, so we are giving them more options in terms of them taking ownership of their condition and how they can best manage it. So the physical activity calculator that we do at booking, because we're seeing women right at the start of their journey, and we find that this is a really good time because often they're ready for change. I think also the motivational interviewing side of things, women generally are very keen to speak to me and are open to discuss their activity levels and are often keen to set goals. I found particularly women I speak to that perhaps have had gestational diabetes in a previous pregnancy, because this is a new pathway for them and they haven't encountered it before, are really pleased that they've got more information than they have had before. I think we are now in line with the NICE guidelines in terms of our physical activity, offering it as a service. Previously, physical activity has been absent in advice, and a lot of that will come down to timing. So we have now embedded it in our system, so it's kind of bringing it up the radar, if you like. Clinicians are speaking about it and are more confident speaking about it following the training sessions. I think it's been successful largely because of the team of people that are involved in it. We're all very passionate about women's health, and I think it's just our perseverance at getting it kind of, like I said, up the agenda within the hospital, and the fact that we care about women and their health.